Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about orthotic appliances and occlusal splints. Let's start. So today I'm going to be talking about on a very superficial level about TMDs and Bruxism like patterns, which are parafunctional habits. Now, as a patient, you need to understand that these are the habits that cause you different types of symptoms, such as pain in the jaw joint, any sort of crepitus or a gravel like sound, deviation, pain or clicking, and muscle soreness in the morning, and because of that you might have other symptoms which might be causing you discomfort. Now, all of these disorders collectively are known as TMDs, that means temporomandibular disorders, and they have their own different symptoms and tests so that we can find out which kind of category you fall into. But on a very superficial level, the main thing is, apart from the fact that we need to remove the cause, the solution also comes in terms of occlusal rehabilitation. That means we give you occlusal therapy, that is splint therapy or orthotic appliance therapy depending upon the case. Now, you can have a plethora of reasons as to why it is happening. You might have bruxism because of psychological reasons, you might have TMDs because of trauma, you might have TMDs because of chronic inflammatory conditions such as rheumatoid arthritis, and that is why it is better that you get to know on a very superficial level what is splint therapy. So splints are basically appliances that are put between your teeth so that some part of your teeth or all of your teeth do not come in contact with each other, and your jaw gets to relax in the most probable relaxed position, which is known as centric relation. Now, I don't want to get into the science of it. Basically, centric relation is how your jaw is supposed to be when it's supposed to be relaxed. And in most of the people who are suffering from parafunctional habits or bruxism and clenching, bruxomania, even TMDs, disc displacement and reduction, all those things do not have a proper centric relation, because of which the whole complex of the jaw joint with the jaw cartilage, the fibrous disc, the TMJ assembly, the fossa, all those things, and the muscles all together are not in harmony, because of which you feel that there is other kind of symptoms that arise, and that might lead to you having fatigue or degradation of the quality of your life. Now, coming to a broad categorization of splints, you have permissive splints, you have non-permissive splints, and you have pseudo-permissive splints. Now, permissive splints are basically the splints that help in disoccluding some of the teeth or all of your teeth depending upon the type, so that your condyle goes into the centric position and it's more relaxed. Now, you could either have an anterior appliance where just your incisors meet and the rest of the posteriors do not occlude or bite, or you could have a flat splint, which is known as a Michigan splint, that disoccludes all of your teeth. That means none of your teeth basically meet each other and the jaw joint relaxes. This is usually supposed to be worn for 10 to 12 hours in the night while you sleep, and it's not supposed to be worn continually for 24 to 48 hours, just overnight 10 to 12 hours if possible, and it takes a learning curve for you to understand. Then you have something known as directive splints or non-permissive splints, where the condyle moves forward. This could be because of any sort of discal injury or any sort of issues with the disc of the temporomandibular joint, and you have an anterior repositioning device which basically puts your the jaw forward, and you can have a posterior bite plane that helps in making sure that your teeth are in a relaxed position, and it is limited to basically if you're having any sort of excursive or protrusive movements, that's why you give the posterior bite plane so it doesn't move away. And these are all the discretions that are taken by the doctor who is treating you as per your symptomology and all the tests, and we have a look at your teeth, and we see if you have any habits such as tooth grinding, night grinding, tooth gnashing, clenching, bruxism, bruxomania, so many things that you might not be able to diagnose particularly, but we as dentists are trained so that we know how much of your teeth have worn out, if the teeth are bearing the load at one point in one position, that is on one side, or not, if there are enough wear facets on one tooth, because of which that the load that was supposed to be borne by the teeth is now being transferred to the joint, and that's why you're having symptoms. So all in all, you have to understand that these are the kind of splints. You have pseudo-permissive splints as well, that could include stuff like hydraulic splints that are known as aqualizers. Let's not get into detail. That is basically a water-filled based appliance splint that you can wear, and that basically adjusts the kind of the jaw forces and all those things. All in all, you have to understand that if you are having any problems as a patient, basically if you're having any problems which are related to your TMDs, do not ignore those problems. You might be suffering from bruxomania, you might be suffering from bruxism, you might be suffering from TMDs, you might be suffering from any jaw related pathologies. So if you're having any sort of symptoms which are related to this musculature and all these areas around your jaw joint, please visit the dentist and make sure that you get yourself evaluated, and then we will follow suit whatever the symptomology and all the tests that we conclude. After doing a thorough examination and investigations for you, we will give you the proper therapy. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's causing you discomfort, and then we can have a dialogue. Maybe it might take me a couple of days to revert back to you on WhatsApp. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.